in the Philippines and worldwide. The enactment of Republic Act number 8423, otherwise known as the Traditional and Alternative Act of 1997, institutionalized the integration of traditional and alternative medicine as an integral component of healthcare for Filipinos. Of concern, however, is that the safety, quality, and efficacy of services cannot be assured if there is no appropriate regulation of practices and practitioners. Thus, the committee deems it imperative to deliberate upon the proposed measures related to the subject matter in line with the health goal, the United Nations Sustainable Development Goals, to ensure healthy lives and promote well-being for all at all ages. The second set of bills seeks to regulate the establishment and operations of the health maintenance organizations and put it under the direct control and supervision of the Insurance Commission. Another bill also seeks to grant mandatory free HMO plan coverage to faculty and non-teaching personnel in the state universities and colleges. The committee likewise deems it imperative to deliberate upon the said HMO bills with the end view of providing better healthcare for Filipinos in line with the Universal Healthcare Act, which specifically provides the individual-based health services shall be financed primarily through prepayment mechanisms such as social health insurance, private health insurance, and HMO plans to ensure predictability of health expenditures. Pursuant to the Universal Health Act, the chair further notes that the DOH, the PhilHealth, and HMOs, life and non-life private health insurance shall develop a standard policies and plans that complement the program's benefit schedule, provided that the coordination mechanism between PhilHealth, Philippine Health Insurance, and HMO shall be set up to ensure that no benefits shall be unnecessarily granted. So we now proceed with the deliberation of the bills related to the Traditional and Alternative Medicine Act of 1997. First on the list is House Bill number 3111, authored by Honorable Rosana Ria Vergara, which will now be sponsored by Honorable Wilker Palma.
Good morning, Mr. Chair. Good morning, my esteemed colleagues, as well as to our resource persons. On behalf of Representative Rosana Ria Vergara, under House Bill number 3111, entitled An Act Strengthening the Traditional and Complementary Medicine System, amending for the purpose of Public Act number 8423, otherwise known as the Traditional and Alternative Medicine Act of 1997, under House Bill number 5032, authored by Representative Richard Gomez, an act vesting regulatory powers to the Philippine Institute of Traditional and Alternative Care, amending for the purpose of Public Act number 8423, otherwise known as the Traditional and Alternative Medicine Act of 1997, and House Bill number 5694, authored by Representative Michael Romero, an act providing for the modernization funding for the Philippine Institute of Traditional and Alternative Healthcare, increasing reorganization, its administration to lead in the research, development, promotions, advocacy of developmental standards and traditional and complementary medicines, and for other purposes. Let their explanatory note serve as their sponsorship message. So move, Mr. Chair.
Thank you very much, Honorable Palma, for sponsoring House Bills number 3111, House Bills 5032, and House Bills 5694. Having heard the sponsorship, we now listen to the position of the representative from the Philippine Institute of Traditional and Alternative Healthcare, Attorney Carmencita Castro Santos. Attorney Santos is now recognized.
Good morning, Mr. Chair, and to the distinguished members of the committee. Good morning, Bob. We support the Philippine Institute of Traditional and Alternative Healthcare of as support the wisdom of the bills. The bills strengthen PITAC by giving regulatory functions. We believe that regulation of traditional and complementary medicine practice and practitioners are needed in order to ensure that these services are safe and of quality, considering that they are being offered in the public. However, the House Bill of House Representative Ria Vergara includes regulation of traditional and complementary medicine products, which is at present is within the mandate of the Food and Drug Administration. But there are no regulation. The Philippine Institute of Traditional and Alternative Healthcare, we develop standards for the practice, guidelines, as well as code of ethics for these different practices. When we say po, traditional and complementary medicines, modalities, ito po yung acupuncture, hilot, chiropractic, naturopathy, homeopathy, osteopathy, Ayurveda. Currently, we have already 11 recognized traditional and complementary medicines, modalities. And there are, based on we conducted a research profiling of these different traditional and complementary practices. Based on our initial research, there are 62,000 already traditional and complementary practitioners, but we only profiled 21,000 TNCM practitioners. Due to absence of regulation, we encourage these practitioners to seek certification for us. So they are seeking certification, but on a voluntary basis. So on our database, we only have 1,477 out of the 21,000 profiled TNCM practitioners.
So just for clarification, the jurisdiction of your regulatory power is for modalities only. So anything that is to be taken is under the Food and Drug, meaning you have money,
Yes.
whether in tablet or in other forms,
Yes.
that is under the FDA. So yung modalities, yung mga
Hilot,
pilot,
yes po.
acupuncture.
Yes po.
Okay. Thank you very much, Attorney Castro Santos.
Mr. Chair, if I may.
Yes, Honorable Papan.
Attorney Santos, mayroon din Attorney Santos sa kabila. Itong PITAP, are you under PITAP? What?
Yes po, under po.
Is this a government agency or under
We are a government
DOS?
controlled corporation.
DOCP kayo?
Yes.
Okay. Do you have your own budget or
Yes, we do have our.
which is different from the DOS?
Yes, Your Honor.
Kasi DOCC kayo, depende sa charter ninyo.
Yes.
Okay. So, thank you, Mr. Chair.
Thank you, Honorable Palma. Before we proceed, we'd like to acknowledge the presence of our Vice Chair, Honorable Angelica Natasha of Party List Youth Level. And of course, I'd like to acknowledge my idol, Honorable Joey Salceda, the second district of Albay. Thank you very much. We now call on Attorney Emilio Poli of the Food and Drug Administration. Director.
Thank you, Mr. Chairman, and the verbal members of this committee. Good morning. Ako po si Emilio Poli on the Food and Drug Administration. On behalf of my principal and agency, we respectfully manifest our full support for the skills to further empower the Philippine Institute of Traditional and Alternative Healthcare
to bolster our responses in order to achieve the objectives of the universal healthcare, seeking to regulate and enforce powers in the practice, insofar as the practice of traditional and complementary medicines under the context of traditional and alternative healthcare system. I would like also to manifest with the indulgence of our colleague from from the PITAC that during the last Congress, we had already an understanding between PITAC and FDA that insofar as the practice is concerned and other modalities, that's for PITAC when we support that. And for products, medicines, drugs, and as defined under the FDA charter, that will remain as within the FDA's regulatory jurisdiction, Mr. Chair. Thank you.
Thank you very much, Attorney Polig. We now.
Science, PRC.
Si Elmoro.
Yes, sir, but wala ka bold sa mga lines.
Okay.
Remo, sir.
Si Remo. Okay. We now recognize Honorable Joanna Remo of the Professional Regulations Commission.
To the Honorable Chairperson and members of the Committee on Health, I'm Dr. Joanna Remo of the Board of Medicine, PRC. So the Professional Regulatory Board of Medicine submits the following inputs, comments, and recommendations, and endorse measures seeking to strengthen the traditional and complementary medicine system in the country. The PRBM supports the contribution, importance of the traditional, alternative, and complementary medicine to the promotion of health in the country. As such, TCM must be developed and enhanced subject to proper and reasonable regulation in order to ensure the delivery of safe and quality healthcare services to the people. Upon review of the proposed measures, it appears, however, that the mandates intended to be granted to the Philippine Institute of Traditional and Alternative Healthcare are too broad and comprehensive as to encompass the existing mandates of other government regulatory agencies, such as the PRC, Commission on Higher Education, Department of Health, Food and Drugs Administration, and Technical Education and Skills Development or TEST Authority, or TEST and the Department of Health. Under the bills, medical practitioners who are in the practice of alternative medicine like acupuncture and naturopathy and others, and who are already under the regulation of the PRC, would then have to be regulated by PITAC as well. The practice of medicine is defined in the Republic Act 2382 or the Medical Act of 1959 as amended. A person shall be considered as engaged in the practice of medicine who shall, for compensation, fee, salary, and reward in any form paid to him directly or through another or even without the same, physically examine any person and diagnose, treat, operate, or prescribe any remedy for any human disease, injury, deformity, and physical, mental, or physical condition, or any ailment regardless, or real or imaginary, regardless of the nature of the remedy or treatment administered, prescribed, or recommended. While the bills define traditional and complementary medicine as those which are not part of the conventional medicine and which are not fully integrated in the dominant healthcare system, there is a thin line that separates the two, given that in both cases, the patient examination and prescription of remedies are involved. The striking difference, though, is that medical professionals under the PRC, PRBM are required to meet strict academic and licensure requirements to be able to practice medicine and are subject to strict standards and regulations while in the practice. On the basis of the foregoing, the PRBM believes that the medical professionals who are engaged in TCM should be under the regulatory authority of the PRC, PRBM, whereas non-medical professionals who are similarly engaged should be under the supervision of the medical professional for patient safety and accountability. The PRBM is inclined not to give its comments to the other provisions of the bills that relate to the TCM products and facilities, as these would fall under the mandates of other government agencies. It is advisable, nevertheless, to consult other regulated professions such as nursing, pharmacy, physical therapy, and chemistry as to the potential impact of the subject measures to their existing scopes of practice. Thank you, sir.
Thank you very much, Honorable Dr. Remo. Any comments from House members, committee members?
With the permission of the chair. Ma'am,
Yes, Honorable Palma.
can you summarize, please? No, make it short. As far as the practice of this alternative medicine is concerned, for the medical and non-medical, and so on and so forth. Make it short lang.
For those who have been practicing under the PRC or the regulated professions, they should be under the supervision of the PRC. For example, a physician who had also training, who is still at the same time practicing alternative modalities, should be under the PRC as well. Because there will be some the complaints that may have arisen in the practice of alternative medicine should be under the Philippine Regulatory Board of Medicine. And for some other regulatory boards, the Philippine Institute had also recognized or accredited other professions, not only the medical professions, but they do recognize or accredits other professions such as nursing, physical therapy, and other courses.
Yeah, Mr. Chair, if I may. Di ba ang mga graduates ng or mga physicians for that matter are already under the umbrella of the PRC? Kasi sabi mo should be. Oh, di ba? Nakaano na 'yun eh.
Correct. May I be recognized, Honorable?
Dr. Remo, can you answer the question of Honorable Palma? At present, the doctors who are also practicing alternative medicine are already under the Professional Regulations
sir.
Board of Medicine.
Yes, sir.
So you are saying
But then
it should not only be the doctors, it should not only be the doctors, but the non-doctors should also be under the PRC and not under the PITAC. Is that what you're saying, Dr. Remo?
May I be recognized, Mr. Chair? Dr. Almoro, also from the Board of Medicine.
Yes, but can you
Yes.
answer first, Dr. Remo? My statement, am I correct in saying that the doctors right at present is already are under the PRC?
Yes, sir.
So you're saying that the non-physicians who are practicing alternative and complementary or traditional medicine should also be under the PRC and not under PITAC? Is that what you're saying, Dr. Remo, or?
We would like that the practice of the other professions should be under the supervision of a physician, sir, because they do diagnose and treat illnesses as well.
And not under PITAC?
It has to be under the Philippine PRC, sir.
Okay. Yes, Dr. Almoro of the
Good
Professional Regulations Commission, Board of Medicine.
Yes, good morning, Chair and other members of the board, of the this committee. We respectfully note that there are practitioners who diagnose patients and make treatments. For example, I saw in one TV that they are prescribing alternative medicine to glaucoma.
Practitioners meaning doctors?
No.
Non-doctors?
Non-doctors.
Okay.
Naturopathy. So they are prescribing something alternative for glaucoma, which if these patients do not receive proper care, they will cause blindness. So what we are saying is that maybe there should be some physician oversight among practitioners, especially those who are prescribing traditional medicine for medical conditions. For the doctors who are practicing alternative medicine, what we are asking is that would they also be under the jurisdiction of PITAC when they're already under the jurisdiction of the Board of Medicine? So who now takes, if let's say, for example, they have some form of malpractice or some form of administrative liability, will they have the administrative liability under the Board of Medicine or under the PITAC? Because they are already under the Board of Medicine.
Correct me if I'm wrong. PITAC, members of the PITAC are also doctors.
Some.
Who, I mean, the leadership of PITAC, I mean, the officers of the PITAC are doctors who are also under the Professional Regulation Board of Medicine.
Yes, but what we saw in the bill that is being proposed, that they will have quasi-judicial and all the practitioner has to register with them. So they are already registered with the Board of Medicine, with the PRC, and they will now be registered with PITAC. So we are asking whether that will be the case, that they will have two registration, or they will be under the Board of Medicine who are practicing alternative medicine.
Mr. Chair, if I may.
Yes.
I think there's no problem. All you have to do is go to the PITAC, bring your PRC license that you're a doctor of medicine. That's it. This is for policy and regulatory purposes only. So that they have their database. I think, Doc, there's no problem for that matter. Hindi naman sinisingle out na kukuha ulit kayo ng board of, diba?
It's a matter of
It's just a matter of coordination. It won't matter. Right? Are you satisfied with, or you want talagang?
No, that I think it has to be stressed out in maybe a discussion with PITAC, that what draws the line, and then what draws the line in patient treatment and patient diagnosis.
Attorney Castro Santos.
Thank you. The main reason why we are seeking strengthening and regulation of PITAC is because there are many practitioners, meaning traditional and complementary, who are providing services na hindi namin alam kung ano po ang kanilang qualification, and yet they are providing services. So yung worry po ninyo, we share the same views and worries na to give na ang ating public is at risk. Yes, we do receive complaints na there are practitioners na calling themselves as doctors, kaya po namin gusto ng regulation para before sila magbigay ng services sa public ay na-meet nila yung qualification at ma-establish namin sa kanila na traditional and alternative practitioners who are not doctors cannot call themselves doctors. Because under our medical act, only yung pumasa po ng lisensya sa PRC ang pwedeng tawaging doctors or medical doctors. So we share the same view po, ma'am.
So are we saying that under the presently those non-doctors or claiming to be doctors, wala pa yung nagagawa? The law, we do not have the law to regulate or to penalize these fake doctors? I don't know.
Mr. Chair, if I may.
Yes, Honorable.
You know, it's okay here in the urban, but in the rural areas, I know of one coming from different region, tricycle driver siya, pumunta sa other region, pag ano niya, para magaling siya magsalita. Nagiging doctor na siya, selling this alternative medicine. So, you know, the public is at risk. Parang number one qualification niya, magaling lang siya magsalita sa radio and this what they call that, traditional medicines. So I think we should pursue that angle, what the chairman was saying, kung pwede can come up with a law. Thank you.
Mr. Chair. Yes, Attorney Santos.
To answer po your.
By the way, how many, under the PITAC, how many doctors and how many non-doctors are in PITAC?
The head of the agency is a medical doctor. Dr. Boots, the head of the R&D, is a medical doctor. The social advocacy head is a medical doctor, and our management service division is a medical doctor as well.
Okay, how about USEC? Is USEC Francie is also,
Yes,
Under
yes,
PITAC.
she is a medical doctor.
okay.
To
Yes,
answer po,
Attorney.
yes, our
Pastor
current
Santos.
law, the RA 9184, or otherwise known as the TAMA law, does not provide regulatory to na i-require sila mandatorily or i-compel sila, or wala po kaming magawa para sa kanila, para tulungan kung sino man to, but only to assist them na kung nasaktan man sila, ay yung assistance to give yung technical expertise lang po namin na based on our established standards of the practice, ito ang dapat sinusundan. We also strengthen our advocacy na yung ating general public is only to seek TNCM practices to only a certified PITAC practitioners in order to ensure na ito ay qualified practitioners. Yung ganun lang po ang nagagawa ng aming institution sa ngayon because of the absence of regulation.
Thank you, Attorney Castro Santos. May we, before you proceed, we'd like to acknowledge the presence of Honorable Steve Chongbian of the Lone District of Sarangani. Thank you. May we now recognize Attorney Eli Santos of PhilHealth.
Good morning, Mr. Chairperson, honorable members of the committee. Insofar as PhilHealth is concerned, Mr. Chairperson, we support the bill on traditional and alternative medicine. On the part of PhilHealth, we are more concerned on the development of packages. Sir. Mr. Chairperson, honorable members of the committee, insofar as PhilHealth is concerned, our objective is to develop a package that will cover services under traditional and alternative medicine. At present, Mr. Chairperson, honorable members of the committee, the Universal Healthcare Law requires, before we develop packages to cover traditional alternative medicine, it must be approved first by the standards of care, Mr. Chairperson, honorable members of the committee, must be approved first by the DOH. And after that, it must be approved by the Health Technology Assessment, Mr. Chairperson. With that, Mr. Chairperson, PhilHealth will develop packages that will cover traditional and alternative medicine. Mr. Chairperson, honorable members of the committee, thank you very much.
Thank you, Attorney Eli Santos.
Mr. Chair.
Yes, Honorable Salceda.
Hi, ma'am. So anong attitude nyo sa EMT? What is the attitude of PRC towards EMT? Emergency medical. Like starts with ambulance driving, blah, 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 until it. What is your attitude to? What is your predisposition? It's not virtually may pagka-medical, non-medical lang practice na yun eh.
Well, we support, sir, the EMT.
Is there a
emergency
PRC?
medical
Is there
treatment
a, is it covered by the board?
No, sir.
But it's being offered by TESDA?
Yes, I think, sir.
So there is a gray area wherein these guys can fit in the universe
Mm.
of human well-being. Tama ba?
I think so, sir.
I'm actually conflicted because I really use a lot of acupuncture myself, no? Almost every week. Well, I trust my, but is there anything, under the sun, under any law? Yeah, can I ask you, do you cover acupuncture? Let me start with,
Yes,
are
Mr.
there
Chair.
procedures?
And other members of the committee. Yes, acupuncture is covered under the traditional and complementary medicine.
So are they covered, are there procedures that are, for example, a manual of procedures or anything like
So
that?
actually under the traditional complementary, under the traditional Chinese medicine, so it covers other modalities aside from the acupuncture. So we also have the traditional Chinese medicine. So we also have China or the Chinese therapeutic massage and also cupping. So iba't ibang modality po just under one
Is it a profession?
modality.
Is it a
In other countries, it's a profession, so they're being licensed.
So how come PITAC did not make any effort to make it a profession?
So
If it becomes a profession, it falls under them. Ganun ba yun?
what we have right now sa PITAC po is we have established a competency standard for the
Para kang
practice.
TESDA on complementary medicine. Ganun ba yun?
It's different with the iba po yung sa kanila, like for
I'm talking
example,
about analogical constructs, sir. Para we can fit you into the entire legal framework.
right now po yung competency standard that we are establishing under under PITAC is
So let's
based
start.
on the
Okay na.
benchmark.
Okay, sa procedures.
Yes po, based.
Okay, let's start again from the start, from input. Then let's start with output. The input, is there any training that is prescribed by PITAC for, let's say,
Yes.
acupuncture?
Based on the competency standard. So we have the didactic
So you work
and the
backwards.
practicum.
There's a practicum.
Yes
Like how
po.
many hours?
Like for example, for acupuncture, so we have our established syllabus. So
good, that's good.
960 hours.
960 hours. Are there schools or, let's say, institutions that have been, for example, accredited by PITAC to offer it?
Yes, we have
Can you name
accredited
one?
training
Can you-
center.
Yeah, can you name?
So
one?
like for example, in the Ateneo de Manila University, so they
Oh.
offer acupuncture for medical doctors, and
Are you
yung the
appealing to
latest-
my school to get approval?
yes, they're accredited by PITAC right now. So the other one is the Chinese hospital.
CGH, basically.
Chinese
Yung
General Hospital.
acupuncturist kasi is being trained by CGH. So 960 hours.
Yes.
Ilang araw ba yun? So
So it's almost 1.5 years.
are there like steps also like acupuncture 1, acupuncture 2, acupuncture
There
3?
were
So
what
what is the pinnacle of an acupuncture?
we based on our established competency standards. So some training center they offer it in a modular way. So others is parang sa
Okay, sir.
school system yung pang
Para maintindihan namin
based on the
how
competency.
to demolish this girl. So in short, sir, do you accredit the schools, no?
Yes, we are accredited.
So Ateneo was accredited by
Yes.
PITAC. And
Yes,
the
sir.
teachers, do they have to go through some kind of accreditation?
They're accredited based on the qualification of the teachers that were also certified by PITAC.
And prior to practice of acupuncture, does the acupuncturist have to pass any test? Or they just
Right
have
now,
or they just have to pass Ateneo, that's it.
we have a national certification committee.
O sir, like test na talaga.
So no, we sa PITAC po ang NCC namin.
I know,
Apo.
sir. But you're like a test the like what
Yes,
for
similar with the TESDA.
so what other after acupuncture, what is that? Do you recognize, I'm all well, chiropractor,
Chiropractic, opo.
that's part of you also, not
Yes.
them, no?
Yes.
You don't recognize chiropractor, right? I see. I also don't, but you do.
Yes, sir.
I went through a lot of chiropractor and it didn't give me any benefit.
Oh.
In fact, I thought that they even diminished my well-being.
Most
So,
of our
I am
chiropractors.
conflicted really because the science beneath. So at the end of the day, it's all about being science-based in all of this. I don't want to lose, providing the gaps in the entire health system. Katulad nitong taga-affiliate, They gave us a motherhood statement. I'm sure in 10 years, they will never get to that. Is DOH promoting you? Where's DOH here? Is it Francine Roa, Laksamana?
We are under the special concern under Dr. Francine Laksamana.
Yeah, she's from Ginubatan. She's
Yes,
from
sir.
Albay. So I have to ask her about this. Pero the word that really strikes fear is the word quasi-judicial talaga. That's baka imbis na quasi-doctor, quack doctor, labas natin dyan. Na. So parang nahihirapan ako talaga na we need, parang meron ba kayong parang parang report or something that will essentially educate this committee or the entire Congress, especially our publics? Kasi ako I'm a believer in acupuncture because I talked to my acupuncturist. She actually works in BRTTH, but she was trained by CGH, so I knew. But I see the conflict between my biomedical doctors and my acupuncturist actually in most of the time. But I have, how do you call that? Tawag dyan. Gusto ko sana makita na maging ma-mainstream kayo sana. And mainstreaming it by force of law is not the way to do it, but essentially through existential realities that you're really part of the medical. So you don't call your practitioner professionals, no? Yes, sir.
Your Honor is certified.
Certified practitioners. You call them practitioner? How do you call them?
Certified acupuncturist, certified.
So ilan lahat yan, sir?
So we have around 11 modalities.
11 modalities. So yung mga ginagamit nila, lahat ba yun certified ng FDA?
Sir, you mean the products, sir?
You
You mean the products, sir?
may mga kuning-kuning sila di ba? Mga kung ano-ano.
Yes.
So are they certified by or PITAC certifies those products? Of course, it has to be FDA.
So supposedly it's the Food and Drug Administration when it comes
Bakit
to products
supposed to be?
and
It is, I
devices.
think, doon pala nahuhuli ka na ka. It has per force must go through the FDA process.
Yes.
So you
FDA.
allow them to, don't you have rules that you can only use FDA approved?
We have, sir.
Can you
only
cite that rule, sir, in your manual? Is there anything in the PITAC IRR which says that your practitioner, your 11 modalities can only use FDA approved? How do you call that? Incidentals. How do you call that, ma'am? Yung instruments.
Devices, sir.
Devices. Tapos ano pa? Are you allowed to ingest? Do your practitioner are allowed to? Karamihan kasi topical di ba? Pero may ingestion ba? Then it becomes a biomedicine.
Sir, some of the practitioner,
Then again, there's something wrong.
they prescribe some health supplement.
Health supplement, like the one that glaucoma that causes blindness.
I'm not sure with the case po, sir.
Have you filed any cases against any of your practitioner? Do you have a board of discipline? PITAC does have a board of discipline, sir.
We have a board,
Not a board of discipline.
not a board of discipline.
Oh, so where does the patient have a recourse for malpractice, for example? The courts. Do you have a table of cases filed against, let's say, your practitioners, PITAC accredited practitioners? None?
None, sir.
So what gives you a camouflage of not camouflage, a cover is the fact that you are don't you think you should not be a GOCC? You should just be an agency of DOH. At the rate you're answering me, I will propose that you should just be a bureau. You cannot be a GOCC with all the financial flexibilities, given the fact that I think the proper control mechanisms are not existent. I'd rather that you become and stripping you of any quasi-judicial powers, because that's really, I can't forgive my acupuncturist because that's my personal choice. But now that I'm a lawmaker, I am a little bit, and she has been with me for 12 years, and she has really grown. It gives me relief. I don't know if the relief is permanent or, just because I see her, I feel better, something like that. But can we come to, kasi nakaano na dito eh. You want a stronger PITAC, no? And a stronger PITAC, I think, should be a bureau of DOH rather than a GOCC. Tama ba, ma'am? No, they cannot be, kasi you're talking about human life. I think
So,
we should the standards for yes, ma'am.
yes po. Yung ating RA 8423 states now we are a GOCCs. But with the current law giving us yung R&D, advocacy, and the development of these guidelines and standards for different modalities, since we are not really earning out of this,
You better become an
Yes.
agency, no?
probably.
Are you willing to be an agency of DOH? You're just part of the DPCB, for example. Disease prevention and basically for non-infectious diseases.
If I will base on our activities and the mandates,
Sa
We are not really
well-being
a
kasi
GOCC.
mukhang okay ako sa inyo di ba? Pero pagdating sa treatment of infectious diseases, are you treading that fine and very dangerous line that non-traditional medicine, when in fact it's very clear in the original law that outside of biomedicine. So is there any claim by any of the 11 modalities wherein they are treating certain diseases or diagnosed? So how do they diagnose the disease, for example? After they're diagnosed by PRC, accredited doctors, then they go to non-traditional medicine. Is that the usual route it takes?
based po on our existing medical act, our
Yes.
traditional and complementary medicine, if they are non-medical, they cannot diagnose or dispense or prescribe drugs, because that's
Is there
considered.
another word for medicine, ma'am? What?
Your Honor, drug.
I'd rather treat them as, being the lowest, not the lowest, naman, like Zumba would probably fall part of a non-traditional medicine. Lipi. Is Zumba a modality of PITAC?
No. Yoga, that's part of
Ano ba?
Ayurveda.
Exercise, but it's, I think, the existence of PITAC can only be established outside of biomedicine. You read the law. It says outside of biomedicine. So I think Zumba properly belongs to you. I mean, can we regulate Zumba under DPCB, for example? I'd rather see you, the best case for you, sir, ma'am, for you to perform your vision is really to be a bureau under DPCB. Kasi pwede ba kayo mag-treat ng infectious diseases? So non-infectious lang. So well-being enhancement lang talaga kayo.
Sir,
I have 34 doctors catering to all my organs except my sex organs, okay? But I have a urologist from St. Luke's, so probably it's covered too. You see, but I still go to my acupuncturist every week. Just I don't know why, but I felt better when I go to her. Anyway, sige, sir. Can you answer that?
different modalities as different.
Can you mention now the 11 modalities? Is it in the law?
So we have the traditional Chinese medicine,
Number two.
So then we have the acupuncture.
Oh, it's Chinese, right?
Traditional Chinese medicine, it involves more on the
Mga
herbal
herbs, herbs,
medicine. Herbal
Mga-
medicine po.
herbs,
Chinese herbs.
Oh, parang nasa Macau.
Yes po.
Oh, kung ano-ano inom sa iyo, isang katutak para mawala yung sipon mo.
Yes,
Anyway, number
decoction or in the form of pills. Yes po.
Nag-FDA ba yun?
So right now, sir, wala pa po sa FDA.
Oh my goodness. So, number three.
So then we have
So
acupuncture.
you're encroaching on the FDA charter.
Uh,
Yes, you are. I'll read to you the FDA charter. Anything that enters the human body,
so
even
that is
food,
based,
food supplements.
sir,
Anyway,
yes,
what
sir.
is the number
Based on the
4?
practice,
Okay na,
sir.
so
So
tatapos
we have
after,
three na, sir.
after the 11, sir, I'll stop. Number 4,
So we have the Chinese therapeutic massage.
puro Chinese. Okay, number
Yes.
5.
Then we have the anthroposophic medicine.
What's that?
Anthroposophic medicine.
Oh my God, how do you define it?
It's a medicine wherein it's similar with the naturopathy, but it's more of a holistic way, the mind, body, and the spirit.
Parang yoga?
It's different from yoga. So yoga is under the Ayurveda or the Ayush. It's
Okay.
an Indian medicine.
So, okay, number 6.
So then chiropractic.
Chiropractic.
Yes, sir. Chiropractic. Then we also have homeopathy.
May chiropractic doon sa Legazpi, studied in the US.
Yes, sir. Most of our chiropractor
And did nothing to improve my state of mind or body. Anyway, number 7.
so chiropractic. Then we also have osteopathy.
What's that?
Osteopathy.
Puro bones.
It's more of a form of neuromuscular
Yeah.
muscles and the bone
Okay, number
ligaments,
8.
bones. Yeah.
Number
Then
8.
we have the hilot. So the Philippine traditional medicine.
But this is covered by TESDA. So are the TESDA courses on Hilo covered by PITA?
Sir, the hilot covered by TESDA is more of the in a form of massage. The hilot wellness. So
Is the one offered in San Benito Farm
so it's more about in a form
or
of
in
massage. But
CBs?
the hilot that we have, sir, is
It's okay,
the
sir.
traditional talaga
I want
po.
to go to number 9 kasi the chairman keeps looking at me.
Meron.
Number 9.
Then we also have the anthroposophic art therapy.
Oh my God, the word amazes me. But what's the meaning of that?
So they diagnose through your art.
Oh, so you have diagnostic.
It's more of an assessment, not a diagnosis like in Western medicine. So most of the traditional complementary medicine, they are more on the assessment.
Yung dalawang babae dito. Oh.
They assess you based on the art that you produce. So ganun po yun.
Ano yan? Feng Shui?
So in they have iba po kasi yung iba po yung philosophical concept nila. So almost of the modalities that are being offered by traditional complementary medicine, they have a different
Pero kung nagkamali sila ng
philosophical
diagnosis,
concept.
so ibig sabihin mali din yung treatment.
Hindi po, may kanya-kanya po kasi silang philosophical concept. Like for example, for
I like the way you keep using the philosophical, but
Yes.
let's go to number 10.
so
But that one doesn't passes my taste.
and then we also have naturopathy.
Again?
Naturopathy.
Pati means
natural
treatment,
products.
No? Ma'am, tama ba? It comes from the word, what's that, in Greek word? Pathology means sickness.
Sickness, sir.
So pati means,
Disease.
sige sir.
Then we
Okay.
have the homeopathy and
So another
homotoxicology.
So you're covering so much of
Yes, sir. So we have 11 modalities from iba-ibang
I
philosophical
think that
concept.
I think it's proper, sir. It's the appropriate time really to review the law so that we strengthen it and reinforce it and increase public confidence in PITAC. And I think it's the proper time, sir. Actually, I'm not, but at the rate you're going, you're covering a universe of things that should have very strict training and then procedural experimentation and scientific
And then probably the institutions that provide them should be properly accredited. Anyway, Mr. Chair, I am happy that it's being tackled by Congress, but definitely I am sympathetic to acupuncture only. And Zumba, I hope that you cover Zumba. Anyway, thank you very much, Mr. Chair.
Thank you very much, Honorable Salceda. Just a follow-up question. How many training centers are of the traditional alternative medicine are available nationwide?
We have around 14, sir. 14 training
14
center.
are all regions,
Not all regions, sir. It's more concentrated on the NCR.
in Metro Manila.
Metro Manila
Okay.
po.
Thank you.
Yes, sir.
Yes, Honorable Solon.
I just want to take off from, I just have a question. I want to take off from Congressman Joey. Yung traditional medicine that you're saying, like the oral things that you take, the root, the mga ganyan, di ba? Any of them FDA approved or?
Yes, po.
Like, how would you get that FDA approved?
Based on the current law of the FDAs, they must be an FDA approved.
Okay, pero I'll give you an example. Di ba, during COVID, itong lingwa, di ba, that's Chinese medicine, correct? And was that FDA approved? I think it was FDA approved, correct? Because hospitals were using it. So how did we do that? In effect, let's say if you have empirical evidence that this root or plant or whatever, let's say helps glaucoma or helps whatever, maybe you can use the example of lingua getting FDA approval to get some of your traditional medicines FDA approved. That's just an observation I had.
Regarding po sa lingua, we provided scientific data to the FDA in order to that lingua be registered as FDA registered.
Okay, ma'am. And then another thing, sir, Mr. Chairman, if I can, when Congressman Joey mentioned massage and chiropractic and hilo, things of this nature, right? They're looked upon as not being medical, correct? Because they're, physical manipulations, no medicines. But let's say, how about PT and OT, diba? Isn't that similar to hilot or massage, diba? You're loosening muscles, you're taking out knots in the muscles and things like that. I'm just saying that I think maybe your group needs to, because you have empirical evidence, right? People are getting better from certain things that you're doing. So maybe there just needs to be a better push to show that evidence to be more mainstream. Anyway, that's just my observation, Mr. Chairman. Thank you, sir.
Thank you, Honorable Solon. Before you proceed, we'd like to acknowledge our Senior Vice Chair, Honorable Anthony Rolando Goles of Party List Malasakit, and Honorable Salvador A. Prieto of the 6th District of Bulacan. May we now acknowledge Dr. Amy Aman of the Philippine Council for Health Research and Development.
Good morning to the body. I am Dr. Amy Aman from the Philippine Council for Health Research and Development, and with me is Ms. Rachel Mendoza, the Program Head for Drug Discovery and Development Program of the PCHRD.
Any position on the traditional and alternative medicine bills?
The PCHRD has no position as of this moment, sir.
You were invited for the deliberation of these bills and you have no position?
Apologies po. We were invited to represent Dr. Montoya. However, we just received the invitation this morning. So we would like to apologize po, and we would like some time to review the bills.
Please submit your position paper
Yes,
to
po.
the committee.
Yes po.
Any other members who wishes to? Yes, Honorable Goles.
Mr. Chair, good morning. I would like to direct this question to PITAC. Any of the PITAC members can answer this question. You mentioned that herbal medicines or medicines whose active ingredient comes from any plant or plant forms are under the PITAC. There is one industry that might come in as soon as legislation would approve it, and that is the CBD or medical cannabis. And if the medical cannabis will be approved by Congress or through legislation, of course, only medical cannabis will be approved. And if, let's say, for example, there is also a move to create a bureau to be in charge of the medical cannabis in its implementation, or let's say, for example, the medical cannabis in a form of its administration can be given to PITAC. Will PITAC be ready for such move, or will you be needing more experts in terms of manpower to be engaged with medical cannabis and its administration? Thank you, Mr. Chair.
First, we will be
Attorney Castro Santos.
Thank you, Mr. Chair. Will be PITAC in the event that it will be given to PITAC. PITAC will be needing additional manpower and expertise as well as budget. We have a very limited budget as of now.
Okay, but with this new bill that we are talking about in the creation of Philippine Institute of Traditional Alternative Healthcare, I hope if this happens, I hope everybody can be flexible in trying to adapt to these kinds of changes in the legislation or approvals in the legislation. Thank you very much. Thank you very much, Mr. Chair.
Thank you, Honorable Goles. Honorable Palma.
Yeah, thank you, Mr. Chair. I just want to take off from Chairman Salceda, as well from Attorney Santos. If it would be okay with you, since you are GOCC, then the word of Chair Salceda is to make it as an agency. We will revisit RA 8423. Mr. Chair Salceda, would that be okay with you?
Wala naman ako akong violent objection dito. Nakikita ko lang if the state, our nation state as a country, if you want future generations to really see them develop, they should be under strict supervision to increase the trust and confidence of the publics of their intended target markets. They should be under strict as an agency of DOH rather than independent GOCC. Hindi na nga kayo dumadaan sa PRC, hindi rin kayo dumadaan sa TESDA, may sarili kayo. So yes, Mr. Chair, I don't want to be very, ayaw mataray, wala ako sa mood.
Mr. Chair,
Yes, Honorable Palma.
with the guidance of the Chair Salceda, anong dapat gawin natin? Are we going to defer this one or get an inputs making revisit 8423 and from GOCC, will make it as an agency of under DOH.
Para sa akin po lang. Ako lang po yun. That's me. But I'd rather see Francine around, but she's not here eh. Si Francine Rawalak sa mga
Si Yusek.
Si Yusek. Where is he? What's the DOH position ba? Where's the DOH? Ikaw ba?
Ano bang DOH?
Kasi baka i-approve natin yan, tapos paano pa.
Dr. Juan Alfonso Perez of DOH. Is he around?
Ito?
Ah, yes.
Wala si Mike.
Good morning, Mr. Chair, and to all the honorable members of this committee. For the Department of Health, sir, we will still, considering, of course, recent developments, we will take this into further study so that we can raise this, of course, with our principals with regards to the proposed direction towards making PITAC as a bureau.
Mayaman ng
Thank you.
mayaman ng Committee on Health. Ay,
So what's your position? Are you opposing or not opposing, or you need time to discuss this?
We need further time, sir, to study the mentioned proposal, sir. Thank you po.
Mr. Chair.
All right. Can we have a time frame so that we will revisit 8423? Because under House Bill number 3111 and the rest, strengthening the PITAC. So since GOCC sila, we want to have a control, and at the end of the day, it's still the welfare of the Filipino people at stake. So yung ang gusto namin na maging institutionalized, it will be a bureau or under the Department of Health. So we need your inputs also so that we can revisit 8423 and do some amendments to the law.
Mr. Chair, can I be recognized?
Yes, Honorable Plato.
Good morning, everybody, our colleagues and our distinguished guests. I just would like to add to what Representative Salceda already asked, Mr. Chair. Sabi ninyo, di ba, wala na po kayong Board of Discipline? Ayun po, isa po sa mga gustong madagdag sa power or authority ng PT EHC ay quasi-judicial power. Sino po ang mag-exercise ng quasi-judicial power kung sakali? Ang board din ba ng PTACH ba? Hindi po ba yun mahirap kasi ang iba pong gusto i-add ng bills na power sa PTACH ay power to inspect at power to regulate. So ang mag-inspect at magro-rule sa inspection na ginawa ay isang body. Paki-clarify lang po. Salamat po, Mr. Chair.
Attorney Castro Santos.
Thank you, Mr. Chair. Currently po, wala po kaming Board of Discipline. Yes po. So meron po kami, because of the absence of regulation, we do have the National Certification Committee for these 11 modalities. Sila po ang tumitingin ng mga kwalifikasyon ng gusto na ma-certified po ni PITAC. So sa function po nila, kung meron pong complaints na sila ay nag-violate ng kanilang code of conduct, so the least that the PITAC could do is to revoke the certification na in-issue po namin. In the event that we will be given regulatory, so mai-strengthen po yung PITAC, in effect, we will create a separate division or unit specific for regulation.
Thank you, Mr. Chair.
Thank you, Honorable Plato.
Mr. Chair,
Honorable, yes, Honorable
super
Salceda.
power ka pala. May FDA ka na, may DOH ka pa, may PRC ka pa. Ano ka ba? Hindi, kasi sagot niya, i-promote, regulate, and punish. My goodness.
Mr. Chair,
Yes, Honorable Cruz.
medyo matatagalan tayo dito. I move that we create technical working group regarding this bill.
So there, there is a motion to create a technical working group to further stress out and maybe revisit Republic Act 8423.
Second.
Duly seconded, hearing no objection. The motion is carried. So a technical working group for the deliberation of House Bill number 3111, 5032 and 5694 will now be created and to be chaired by Honorable our Vice Chair, Honorable Angelica Ko and
Dr. Kung Goles.
and our Senior Vice Chair Anthony Goles as members of the technical working group. We now proceed with next topic on health maintenance organization. May we now recognize Honorable Rufus Rodriguez of House Bill number 5336, which will now be sponsored by Honorable Raul Manuel in his behalf.
Mr. Chair, in behalf of Rep. Rufus Rodriguez, I would like to move that the explanatory note of House Bill number 5336 be entered into the record as the sponsorship speech of Rep. Rufus.
Thank you, Honorable Manuel. For House Bill number 5568, authored by Honorable Eduardo Brother Eddie Villanueva, will be sponsored by Honorable Cruz.
Mr. Chair, allow me to read the explanatory note of Honorable Eduardo Brother Eddie Villanueva regarding providing act for mandatory pre-health maintenance organization plan coverage to faculty and non-teaching personnel in state universities and colleges and for other purposes. Article 14, Section 5 of the 1987 Constitution mandate that states shall assign the highest budgetary priority to education and ensure that teaching will attract and retain its rightful share of the best available talents through adequate remuneration and other means of job satisfaction and fulfillment. Toward this end, one of the efforts undertaken by the government is the implementation of an across-the-board increase in the salary schedule of civilian government personnel. However, problems persist with regards to the provision of adequate remuneration and other means of job satisfaction and fulfillment to faculties and non-teaching personnel in state universities and colleges. One of these problems is in the aspect of healthcare. If the personnel were to suffer from debilitating illness, limited PhilHealth coverage would only answer a fraction of the cost of treatment, and the rest would still be shouldered out of the personal pocket. This is especially alarming considering a full-time lecturer classified as Instructor 1 in state university usually only receive salary equivalent to salary grade 12 or around 22,938 per month. The strain of hundreds of thousands of pesos in hospital bills and their meager salaries would definitely take a toll on their standard of living and quality of life. An emergency of this sort may possibly even put them into enormous amount of debt. This bill seeks to provide faculty members and regular non-teaching personnel of SUCs and with pre-mandatory health coverage provided by health maintenance organization under this bill The Board of Regents of each SUC has the authority to decide on the form, coverage, and terms of the HMO plan without any need of approval from other agencies or officers. A pre-HMO coverage will not only increase the job satisfaction among SUC personnel, it will also ensure that a healthy pool of faculty and non-teaching personnel will be able continuously and rigorously teach and shape the minds of younger generation. The immediate passage of this bill is earnestly sought. Signed, Honorable Eduardo Brother Eddie C. Villanueva.
Thank you very much, Honorable Cruz. May we now hear from the Department of Health. Dr. Alfonso Perez. It's not around, so we'll now recognize Attorney Eli Santos of PhilHealth.
Thank you, Mr. Chairperson, honorable members of the committee. We support the bill, Mr. Chairperson, insofar as it recognizes that if the personnel of HSUCs were to suffer from a debilitating illness, limited PhilHealth coverage would only answer a fraction of the cost of treatment, and the rest would still be shouldered out of the personnel's pocket. We also support the bill, Mr. Chairperson, honorable members of the committee, that the faculty members and regular non-teaching personnel of HUCs must be provided free mandatory health coverage. But our position, Mr. Chairperson, honorable members of the committee, is that as mandated by law, we are obliged or duty-bound to formulate a supplement. We can find this, Mr. Chairperson, under the IRR of the UHC, particularly under section 11.8, 11.8C, that PhilHealth shall set up the following funds: a fund for optional supplemental benefits that are subject to additional contributions. Mr. Chairperson, honorable members of the committee, the PhilHealth board already issued a resolution which will create and formulate such supplemental benefit, and we call it PhilHealth Plus, and this will cover initially government employees, Mr. Chairperson, honorable members of the committee. And at present, we are still developing this project, PhilHealth Plus, Mr. Chairperson. Our timeline for implementation, pilot implementation, is on January 2024. Mr. Chairperson, honorable members of the committee. Thank you very much.
Thank you, Attorney Eli Santos. So from the Department of Health, may we now recognize Dr. Alfonso Perez.
Good morning, Mr. Chair, and to all the members of this committee. The DOH supports the intent of this legislative measure, which seeks to provide mandatory free HMO plan coverage to faculty and non-teaching personnel in state universities and colleges for other purposes. It is noted that the HMO coverage shall be in addition to the existing PhilHealth coverage provided. So this measure is aligned with the direction of the health sector towards the progressive realization of universal healthcare. Thank you very much.
Thank you very much, Attorney Perez.
Mr. Chair, point of clarification, Mr. Chair.
Yes, Honorable Goles.
We have two bills at hand right now, and we have two proposed bills at hand right now. And I think for the Department of Health, they only manifested their support on the bill that was filed by Congressman Villanueva. I would like to know if they are also in favor of the bill filed by Congressman Rufus Rodriguez, and so as PhilHealth. Thank you very much, Mr. Chair.
Thank you, Honorable Goles. My mistake. We would like to hear first the sponsorship of the bill of Honorable Rufus Rodriguez.
Mr. Chair, it was already, yeah, it was already,
out. Okay, so may we hear the position of the Department of Health on House Bill 5336?
So good morning once again. So with regards to House Bill 5336 regarding regulating the establishment and operations of health maintenance organizations and for other purposes, sir, we will submit our official position paper regarding this House Bill. Thank you very much.
But are you in favor of the bill or not?
For clarification, sir, yes, we are in favor of the bill, subject to further recommendations that we will be submitting officially to this committee, sir. Thank you very much.
Can you have a time frame on when your position paper be submitted?
1 to 2 weeks, sir. We will submit to this.
Can we
committee.
have 1 week?
Yes, sir. We will submit.
Thank you, Attorney Perez.
Mr. Chair,
From Honorable Salceda.
pasensya na po kasi actually I'm going to the 4th floor. Sabi ko, ang layo, dito na lang ako. Nalantakan ko tuloy yung pitak. So, napitak ko. Nagtataka ako dun sa ano, do you have that power to discriminate, sir, under universal healthcare? You have PhilHealth Plus. If you have PhilHealth Plus, it should be PhilHealth Plus for everyone.
Attorney Santos.
Mr. Chairperson, Honorable Representative Salceda, we are based on the mandate under the UHC. PhilHealth is mandated to set up the fund and cover supplemental benefits. So meaning, Mr. Chairperson, Honorable Representative Salceda, this will be on top of PhilHealth.
Why only government employees?
At present, Mr. Chairperson, that is the mandate, but
Tatumbling ako pag inulit mo yan, ha?
I
No, it
understand.
it goes against your legal framework. It's called universal. So you don't have the right to discriminate. Yes.
Mr. Chairperson, the objective really is to cover us, everyone, all Filipinos, as found under the Universal Healthcare Act. But at present, Mr. Chairperson, the major concern is on the government employees, Mr. Chairperson. Please.
Anyway, sir, I think we're treading on very slippery slope. You will fall off the cliff, I think, at a certain point. So anyway, Mr. Chair, just on the, I prepared some for Rufus Rodriguez. No, under EU 192 in 2015, the power to regulate HMO was transferred from the Department of Health to the Insurance Commission. The same EO defines an HMO as a juridical entity legally organized to provide or arrange for the provision of pre-agreed or designated healthcare services to its enrolled members for a fixed prepaid fee for a specified period of time. I actually have some reservation with this singular regulatory mechanism because the risk component seems secondary. Given the way HMOs operate, it seems to me to be primarily a way to deliver healthcare services. In other words, it's not an insurance. But I support this bill in general because there is no regulatory framework. Because apart from EU 192, we do not have a statutory definition or legal framework for HMO regulation. No one has a statutory mandate to enforce laws on HMOs. HMO typically thrive in countries where there are leakages that might be arising from poor management by the public sector. For the user, the incentive to get an HMO is that the network of hospital which an HMO serves is typically superior to the quality of primary care public hospital. So generally, the better the public healthcare service, like Taiwan, where there are no HMOs, the smaller the HMO sector. We currently have only 29 HMO in the countries. Before there were more than 50. In advanced countries, including the US, incidentally, in the US, there are only 50 HMO na lang natitira. A lot of them were already delisted from the stock exchange. The HMO sector has been declining precisely because the incentives are reversed in HMOs. And therefore, there is generally bad feedback about their service in comparison to the public healthcare or even for fee private sector healthcare system. The HMO makes more money when it provides a lower or less frequent care because the services have already been prepaid. In some countries, it also complicates the availability of doctors since some doctors elect not to practice outside an HMO network and therefore creates supply restrictions on healthcare. In other words, the HMO system has a space in our current healthcare system. Insofar, especially given the comments of Philip kanina, as it continues to have a leakage and dysfunctions, especially in primary care. Primary care. Yun ang trabaho talaga nila sa ibang countries. But we also need to regulate certain areas such as competition, minimum standards of care, doctor availability, vis-a-vis the medical sector in large. Apart from that, what I would like to see answered in the bill, one, is whether doctors are allowed to choose to serve exclusively in HMO clinics. Two, whether an HMO plan can be chosen in lieu of PhilHealth contributions, especially in the tax deductibility provisions of this bill. And number three, whether HMO hospitals are allowed to serve only HMO member patients. So, Mr. Chair, I will just submit this paper because I'm looking at it from the perspective of macroeconomics. So I will just submit a printed copy. So thank you very much for giving me space for my comments. Thank you.
Thank you, Honorable Salceda. Before we proceed, we'd like to acknowledge the presence of Health Committee member, Honorable Larny Lavin Roque of the 4th District of Bukidnon, and Honorable Rodolfo Ompong Ordanes of the Senior Citizens Party List. From the Insurance Commission, we now recognize Attorney Reynaldo Regalado. Attorney Regalado. He's not around, so we'll proceed with
Mr. Chair. Good morning, Mr. Chair. Commissioner Regalado just stepped out of the room.
okay. So we will wait for him. While waiting, we now recognize Mr. Emilio Aquino of the Securities and Exchange Commission.
Attorney Jillian Cruz.
In his behalf, Attorney Jillian May Cruz.
Good
Please
morning, Mr.
recognize.
Chair. Good morning, Mr. Chair, and to the honorable members of this committee. The SEC fully supports the passage of both bills. However, we generally differ to the comments and position of the Insurance Commission with regards to the establishment of HMOs. However, insofar as the primary registration of the HMOs are concerned, Mr. Chair, may we be given additional time to finalize our position paper?
Please submit your position paper in 1 week.
Okay, Mr. Chair. Noted, Mr. Chair.
Thank you, Attorney Cruz. We now recognize Attorney Reynaldo Regalado of the Insurance Commission.
Good morning, Mr. Chair and members of the committee. With reference to the two House bills, we would like to express our full support for the aforementioned bills. By fostering the growth of HMOs, we can create a more competitive environment that caters to diverse health needs of our countrymen. Firstly, we support the efforts of the committee to provide clear and comprehensive operating guidelines for HMOs in the Philippines. By establishing a well-defined framework, we can ensure that HMOs operate with the highest standards of integrity and accountability, thus safeguarding the well-being of the Filipino people. Secondly, we also support the bill that seeks to provide the HMO coverage of faculty members and regular non-teaching personnel of SUCs the academic and non-academic personnel of our state colleges and universities. By prioritizing their well-being, we invest in a more educated and effective educational workforce, ultimately contributing to the holistic development of our educational system and personnel. As this commission is currently the agency in charge of the regulation and supervision of HMOs as provided and stated by Honorable Congressman Salceda since 2015 through an EO, we stand ready to provide any technical assistance required in ensuring that the objectives of the bills are met. We thank you for the opportunity to provide our position, and we look forward to a greater cooperation of our agency with the Congress. Thank you and good morning.
Thank you, Attorney Regalado.
Chair, sir.
From Commission on Higher Education, Mr. Nelson Aparejo is now recognized.
Thank you, Mr. Chair. For the CHED is just to provide data for the non-teaching and teaching personnel in SOCs. So yesterday, so far CHED, the data on CHED is only for faculty. CHED is still yet to include the non-teaching faculty in the regular CHED data collection system. So what we did yesterday, we requested DBM for the plantilla positions in SOCs, and DBM provided us just now the data total of the plantilla positions as of 2023. It has a total of 76,590 total plantilla positions in SOCs. So we need, on the part of CHED, we need to check first or to separate what is the total number of the non-teaching and teaching from this total 76,590, and we have to submit to the secretary immediately if it is already available, Mr. Chair. That's all, Mr. Chair. Thank you.
So you are for these bills?
CHED will have to submit its official position paper, not for this day, but maybe within this week or next week, Mr. Chair.
So you are not in a position to say whether the CHED is supporting the bill or?
Definitely, Mr. Chair, because the advice.
Definitely yes or no?
No, Mr. Chair.
You are not supporting the bill?
No, I am not authorized to say to state the position, because the advice from the CHED legal office yesterday is just to provide data for non-teaching and teaching personnel in SOCs. Thank you, Mr. Chair.
Mr. Chair,
Palma.
from the CHED, in the event, sino magbabayad ng premium? Can I have a rough estimate? Magkano premium per month, per year? Rough estimate, 10,000, 5,000? 10,000. 76,500 times 10,000, how much? That's 76 million. Tama ba? More than 76,500 times 10,000. 700? 60 M? Oh, that's a lot of money. Saan kayo kukuha ng pera niyan? We are now in the budget season. We want to know, Mr. Ched. Oh, you're not listening to me.
Apologies, Mr. Chair. I am not in a position to say the other information from CHED.
Yes, what I'm saying, what I'm asking, are you going to ask Congress for additional budget just to pay the premium of this teaching and non-teaching position in the SOC?
Mr. Chair, I will have to refer to the higher up.
Oh, why are you here? You're not supposed to be here if you cannot answer our, Sige, I'll excuse you.
Yes, sir.
But, next time, if Chairman Popoy, there's an ongoing chat there
Yes,
right now in the other room. I think you can ask somebody
Yeah.
who's more knowledgeable on this. Do not make but anyway,
Yeah.
sige,
Mr.
I'll
Chair,
excuse
may-
you for that.
Okay, thank you,
But
Mr. Chair.
next time, do not come here when you're not in the position to answer.
Of
Mr.
course,
Chair,
of course.
may we know what is the position of our, the good gentleman who is
Mr.
representing Jet?
Aparejo, may we know your designation?
Assistant Chief of Planning, Mr. Chair. Actually, my task is just limited for providing data information. Other positions on the provisions of bills is not in my,
You know, dapat planning, assistant planning ang ano ka. Alam mo, yung plans ng CHED. But anyway, I'm going to excuse you.
yeah.
Next time, send somebody. Because budget thesis is on the ano na.
Yeah, of course.
So at the end of the day, you'll be asking help from us.
I understand, Mr. Chair.
Which I'm going to tell you, we cannot also help you. Okay?
Okay, thank you very much. I understand very much.
May we now recognize from the Philippine Association of Health Maintenance Organization Companies, Mr. Christian Argos.
Honorable Chair and honorable members of the committee, the Philippine Association of HMO Companies supports both bills. The HMOs have a key role to play. In fact, our role is enshrined in the Universal Healthcare Law as a complementary partner of PhilHealth. We are not meant to replace PhilHealth, but due to the complementary nature of our benefits, where PhilHealth is the first payer, tapos kami yung nasusunod, we feel that there is a role to play. With respect to the second House bill, we're more than happy to engage PhilHealth on that in the manner of implementation. We could either be a subcontractor of PhilHealth or directly provide HMO services to the Department of Education and other government employees, of course, subject to the availability of funding and appropriation. But we do not see ourselves as a competitor to PhilHealth, but rather, again, as the law states, our role as an HMO, we are complementary in nature. I look towards the comment of Honorable Representative Cruz earlier today, where the huge out-of-pocket that Filipinos incur, even with PhilHealth coverage, is a concern. In fact, when you look at a typical HMO client, yung kino-cover ho namin, the support value of PhilHealth is around 13%. Ibig sabihin pag na-confine ng isang individual who's a PhilHealth member, PhilHealth covers 13% of the inpatient bill. And about 87% is covered by the HMOs, and a little amount. Typically, pag HMO client ka, wala na kayong out of pocket. Basta nasa limit ho kayo ng MBL. So I think in the short term, there is a role of HMOs for the progressive implementation of UHC. And with respect to House Bill 5336, we also support it. But with the indulgence of the committee, we would like to also submit our comments to the bill. There are certain provisions that we feel should be considered, including the taxation, the tax status of HMOs. In the industry today, we have insurance companies with a life insurance license that offer HMO-like services, but they are not subject to value-added tax. So there is subject to a final tax of 2%, whereas HMOs are covered by VAT, so 12%. So in that respect, there's already an asymmetry, and the new HMOs that moved in 2015 to the Insurance Commission's regulation have a disadvantage in competing in the market. And when you look at the HMOs, the largest HMOs are categorized as HMOs. So Etica and Coco Life are not part of the biggest HMOs in the country. So and there are also issues about regulation on brokers and commissions. Here in the Philippines, unlike let's say in other countries where commissions on healthcare services and insurance are in the single-digit range, here brokers actually demand 15% commission, so taking up a lot of the resources that could otherwise be spent on delivering healthcare services. So we are prepared to submit our comments on the bill. And also we are prepared to send our resources and representatives should the committee decide to form a technical working group to discuss this further. Mr. Chair, members of the committees, thank you.
Thank you, Mr. Argos. A brief remark or position from Dr. Leah Yolo.
Good morning to all, to our honorable chairman and to all our honorable congressmen here. I would just like to add, the discussion of Mr. Argos that HMO is a special kind of industry. It should have the jurisdiction of the DOH because the hospitals, doctors, clinics are with us. It is on the medical business and together with the insurance commission. In my opinion, HMO should not be treated like a life insurance. So I agree with Mr. Argos that we should form a technical working group to support and strengthen what is an HMO. I propose that we have an HMO code. We should draft an HMO code so that there will be a regulatory body. Thank you.
Mr. Chair. So you're saying you prefer that the HMOs be under the Department of Health rather than the Insurance Commission?
It should be both the DOH and the Insurance Commission, or it should have an HMO commission.
Mr. Chair. Okay.
Mr.
Thank
Chair.
you. Yes, Honorable Goles.
Mr. Chair, may I have some brief questions to the insurance commissioner? If you would allow
Please
me, Mr.
proceed,
Chair.
Honorable Goles.
To the insurance commissioner, Attorney Regalado, sir, what do you think is the nature of an HMO under the current laws and issuances of the insurance commission, Mr. Chair?
It's
Attorney Regalado.
it's not an insurance product, and it has to be made clear. And the distinction between an HMO and even a health insurance has to be further clarified, especially this is a prepaid health service, and it is not something that's at need to a certain extent that has to be clearly thought of. May I give further comments on this? HMOs has been given to us in an executive order in 2015. There's much that we have learned from it. 2015 through an executive order of the then President Aquino. So now we have the benefit of 8 years. Actually, this afternoon is supposed to be our second dialogue with the HMO organizations and their members, because we really have to really find a clear path on how best we should be holding and regulating an important part of our universal health care objective of our government and our health agencies.
Thank you very much for that answer, Attorney Regalado, Mr. Chair. So you just mentioned that it is not the same, or it does not fall under the same class of insurance companies or pre-need companies that are under the supervision control of your office, Mr. Chair. So since the HMOs are under the supervision and control of the Insurance Commission, Mr. Chair, does the commission have the competency or competence to regulate HMO, granted that it does not fall under the same class of insurance companies, Mr. Chair?
Surely, Mr. Chair, Congressman, Vice Chairman Goles, surely we have the technical competence on the side of checking on financial statements and the viability as an enterprise to ensure that the continued financial strength is covered by the services that they intend to give to the public. But for the medical, the health part, it has to really be a synergy with the Department of Health and even PhilHealth. So with the objective of universal healthcare, I think we have to really look at this more seriously. But be that as may, it is our responsibility to still hold on to how best we think the public interest would be served by having IC at still being mandated as present to take care of HMO and its HMO interests of our public.
Thank you very much, Attorney Regalado. I really empathize with the Insurance Commission, considering that you can only control, regulate, oversee insurance companies or companies of the same class. But truly, you mentioned that you are not so competent to oversee, control, and regulate the managed care business or industries, because it entails a totally different discipline, Mr. Chair. Most especially managing clinical outcomes, patient care, and health service delivery, which is not part of your mandate nor part of your competency, not just as an office but also as with regards to your personnel. So, Mr. Chair, truly there is a gap now, or the HMOs are at a limbo right now. Where do we belong? Who regulates us? If we are being regulated by a certain body, we understand they're not capable 100% fully to regulate the HMO industry. So the root cause of this misunderstanding or gap in regulating the HMO would be the executive order that was filed 2015. So, Mr. Chair, if we can further study this, and maybe the Office of the President can be more enlightened with the discussion or the outcomes of discussion of the regulation of the HMO, having an outcome of repealing this executive order, or let me manifest right now that I have that I will submit my version of an HMO bill, or if it has already been submitted in this in Congress, that seeks to establish a comprehensive and transparent regulations for the HMO to ensure the financial stability, sound management, and ethical standards in delivering healthcare services. Mr. Chair, thank you very much.
Thank you, Honorable Goles. Before we proceed, we'd like to acknowledge the presence of Honorable Eulogio Rodriguez of the Lone District of Catanduanes and Honorable Charis Ann Hernandez of the Lone District of Calamba City. Thank you.
Mr. Chair, before
Yes, Honorable Palma.
please educate us. Yung bang insurance company can operate at the same time as an HMO? Presently ngayon, Attorney Regalado, with the
Actually,
provision of the chair.
that's a very important observation, because in a lot of jurisdictions, the lines are not clearly drawn on this, to the extent that for our purposes, there are a lot of insurance companies that have bought HMOs already. And the life insurance companies have also their health insurances that to a certain extent rightly or wrongly overlap or become redundant with respect to HMOs. But freely, HMOs and health insurance can complement each other. And that's where we are supposed to make sure that these things are clearly drawn and clearly stratified, so that a proper regard and a proper regulatory framework can be made.
Mr. Chair, do we have a representative from the BIR here? BIR, wala. Ang question ko, sir, ganito. What is the mode of taxation for taxation purposes? The life insurance, which they charge 2% as against MHO, which they charge value added tax of 12%?
Yes, that's the present dispensation, but I think we have to give it to Congress. You have passed PIFITA, and it's in the Senate, and we're monitoring this development because we want to see a parity on the services and a parity on the taxes that are being asked of our agencies, especially those that are under regulation. So we think that by the time it would be passed, there would be this equitable treatment of HMOs with life insurance companies.
Yeah, kasi Mr. Chair, looking at the picture, there's a disadvantage to the MSO as against the life insurance company. Pag bibidding yung mga private or government entity, lugi na kayo. Di ba? Kasi 2% as against the value added was 12%. Lugi na, di ba? So, but anyway, here in the House of Representatives, I think our provider is doing good naman. As based on our experience, on my personal experience, okay naman yung provider namin. Anyway, I would like to suggest also, Mr. Chair, with your permission, if the Insurance Commission, as well as the Association of MSO, can submit a position paper for us to lobby before the President, and we come up with our position papers also. That kasi if we wait for legislative actions, it will take time. So I think just repeal the executive order and question again, saan ilalagay yung MSO? Would it be under DOH or Insurance Commission pa rin, or whatever it is?
So for our resource persons, especially the Insurance Commission and the Association of Health Maintenance Operation, please submit your position papers.
Any questions?
Sir,
Uh,
ano lang?
Yes.
Can you, I know for purpose of discussion lang, which do you prefer? MSO? Kayo, MSO? DOH? Kasi mahirap yung dalawa eh. Mag-awa.
Yes, Dr. Yolo.
I prefer to have a HMO commission, yung single lang. Ando na lahat yung DOH at saka yung financial.
Wait, it's under ano yung commission?
Yun
Saan
pa-
natin nilagay yan?
You have to establish.
Create
HMO.
another one?
Yes.
Ma'am, nag-right-sizing na tayo. Tapos here you are creating another monster? Ay.
Mr. Chair, I just recently
Yes,
filed,
Honorable Goles.
I just recently filed a bill yesterday. I don't know if my staff is here, if it was filed yesterday. Under that bill, correct me if I'm wrong, Attorney Regalado, can you name a country wherein the Insurance Commission has under its office any HMO?
We have gone through some of the jurisdictions. We're not very sure if there's one. Which the US, of which HMOs are patterned, is covered by another agency, and it's not an insurance. It's not an insurance agency.
Thank you very much. So, Mr. Chair, it clearly states that, or it clearly is being manifested that no country in the world would have an HMO under the wings of an insurance commission, and therefore, in the bill that I filed, I placed the administrative management and the regulation of HMO under the Department of Health, considering that it involves managed care services. Okay, but under the Department of Health, it will be creating that separate entity that you're mentioning. If you want your separate department for that, then maybe your grandchildren will not even see it forthcoming. But if you put it under an existing department already and having a different discipline that will regulate your body, then it's doable and it's going to be much quicker. And maybe you yourselves can see it at hand in the very near future. And then we just repeat, we just tweak it as we go along, knowing some birth pains in the beginning, but actually becoming more efficient later on. Thank you.
Before we proceed, we'd like to acknowledge the presence of our Vice Chair, Honorable Ray Florence Reyes of Party List Anak Kalusugan. Just a question.
Mr. Chair, before I,
Yes,
with your permission, QH, can you make a study if it would be possible under the bill or under presidential proclamation, whatever executive order, whatever it is, to make it is a part of the DOH bureau na hindi na tayo magdagdag ng personnel, multitasking na lang tayo so that it will be, we can fast track this. Otherwise, if we want to have a law passed by this Congress, ang tagal. So siguro 2021 Congress, 22nd Congress, hindi pa maano yon. So I would suggest, Mr. Chair, if the Insurance Commission can submit the position paper, MSO can submit the position paper, as well as DOH. Sino pa? And those that are in the business, para we can consolidate and we can come up with a position paper. We'll try our best to lobby before the president for another executive order. But sir, are you in favor of the executive order passed during 2015?
Yes, actually, the executive order of 2015 was made through an opinion of then Department of Justice. Because previous to that, we are the favorite of government when there's certain industry that has some problems. So previous to this, there was pre-need. And they said, I think in the opinion, said that more or less this kind of industry is like a pre-need industry to a certain extent. And therefore, of all the agencies in the government universe, I think this is the IC that can hold it at the time. But I guess we stand ready. As far as we are concerned, we still have the mandate to do well on how we manage HMOs right now. But given the developing situation, I think we stand ready that in case there would be decisions that this has to be moved or reconfigured, we would always be available to provide technical competence on all these matters.
Last na lang talaga, Chair.
Yes,
Ha?
yes,
If you give your permission. Sir, halimbawa, we'll retain the MSO under IC, okay? But can we have equal or level playing field wherein the life insurance could not enter into the business of MSO? Purely on the MSO na lang ang HMO pala, not MSO, involved in this, in the maintenance organization, health maintenance organization. Would that be possible? Can you come up with that?
It has been that way previously, but with the developments in the health field, there are certain products that have been developed through time that to a certain extent somehow overlaps to a certain extent on how they are presented to the public. The problem here actually is that people need to see the synergy in these health products. We approve the health products, and we are always asked on how these things are supposed to be treated and regarded by the public. But we would be getting from there. And if you want to have, if it is clear, we want to make clear what products are supposed to be, which industry is supposed to be holding, or which concern is supposed to be holding, Mr. Congressman.
Can you please incorporate that in your position paper para the committee will have a thorough study on that? Thank you, Mr. Chair, for your indulgence.
Thank you, Honorable Palma. Just an observation. The HMO has been under the Insurance Commission since 2015. That's around 13 years. How many years have the HMO under the Department of Health? For the longest time.
The longest time.
It
So
was
that's more
only-
than,
Yeah, it was, Mr. Chair, it was only through.
the
an
HMO
app-
started when?
Registration.
Early 60s, 70s, 80s?
About 40 years ago,
O
Mr.
40
Chairman.
years ago. So kumbaga galing na siya sa DOH, punta na naman siya sa Insurance Commission, and both admit na mayroon silang kakulangan.
Yeah,
I mean, in your statement earlier, you're okay with the technical but the medical aspect nahihirapan kayo.
yeah, it
In the
really
part of
needs
the
improvement,
DOH,
Mr. Chair.
okay sila sa medical pero nahihirapan sila sa technical. So really, we really need to have a thorough study on this, I think. And
Mr. Chair.
Yes,
May I make a motion
Goles.
to have a technical working group solely for the study of this so that we can judiciously advise the president on how to move, whether or not we have to repeal the executive order that has been paralyzing the HMO industry. So move, Mr. Chair.
before we act on the motion, I'd like to acknowledge the presence of Honorable Virgilio Lacson of Manila Teachers Party List. Thank you very much.
I do second, Mr. Chair.
So there's a motion to create a technical working group.
Second.
And duly seconded. Hearing no objection, the motion is carried. The technical working group will be chaired by the proponent.
I would
The
gladly
movant,
accept.
I mean, the movant.
I would gladly accept,
Vice
Mr. Chair,
Honorable Goles.
on that move. Thank you very much, Mr. Chair.
Mr. Chair,
Yes, Honorable Roque.
may I make a motion that the members present here be made co-authors of this bill and including the previous bills, subject to any style and amendments that will be derived from the technical working group or committee reports as well, Mr. Chair.
So there's a duly seconded motion that all those present here who wishes to be co-authors of the bills be made so. Hearing no objection, the motion is carried. Before we adjourn, I'd like to ask personal experience. I've been in practice for almost 30 years. What happens to the HMOs na nagsara? And dun sa mga receivables ng mga healthcare providers and hospitals?
We have provided we have a specific division that covers it, that also covers those in the insurance industry. We do it through a process of first we do the conservatorship, then we try to do rehabilitation, and if we cannot really have that rehabilitated, we go through the liquidation phase already. What's important is at the end of the day, all those that have pending receivables from these companies are properly given or distributed. Whatever the assets are that are remaining would be available. This is happening right now because we sympathize with the HMOs, especially this year and last year. There's medical inflation, and we are very aware of that. And we have so many. It's the cost that they have figured out for the plans and the programs and the budget that they did for this year and the past year has not been very kind to the arrangement, and it's because of our HMO public that have tried. They are now trying to get all this because of now it's face to face and we're all out. All these services they would run to immediately get. And actually, we are supposed to be having our second dialogue with them because we have to try to guide our industry and to ensure that they can go over this very challenging time.
I understand your sympathy to the HMOs, but I hope you also sympathize with the doctors and the hospitals who already given services and for the past 20 years are still waiting for their receivables. Kumbaga, may maaasahan pa ba ang mga doctors, like say, yung mga HMOs na nagsara 10 years, 15 years ago?
I would check on the specifics, Mr. Chair, and we would gladly provide you the proper information.
Thank you very much, Attorney Regalado. Yes, Honorable Reyes.
Thank you, Mr. Chair. Just a few questions. I don't think it was articulated properly with regards to the insurances, the HMOs. We don't currently have a policy wherein they are required to either pool together or to reinsure these policies so as to minimize the risk, so that we do not get these incidents of receivership or liquidation. We've never had such kinds of policies, have they?
Yes, that's true. Which the pooling system we have done in all other insurance products, but they are not insurance products, but they have organizations that now we have two organizations. Actually, one of the discussions that we're supposed to be doing this afternoon for the dialogue is how to ensure that there's pooling, because it's so hard for us to when somebody is trying to get under, there's limited asset on their own, because the assets that are supposed to cover this, if it were a pool, then somehow it can be bigger. It's the same way that we're trying to do these things with the cooperation of Congress on having catastrophe rates handled by a pool.
Yes. So yeah, it would be good to have it pooled or reinsured to somebody who could give a certain level of stability, ideally in something of within the same nature. You think PhilHealth is capable of reinsuring you?
We would check on what is the name, what group or company would be able to do that. Our initial scoping of the health environment, even abroad, does not provide this certain area of range. To a certain extent, a reinsurance that is akin to an HMO organization. So, but we would try to see how best that can be addressed.
Yeah, I posed that question because after the previous discussion before, wherein PhilHealth seems to be more than capable of turning out a profit, then I believe that if it is something that is for the benefit of our the policyholders in the HMO, it helps that something that is supported by the state to ensure that these HMOs don't go underwater. Just my observation, Mr. Chair. Thank you.
Thank you, Honorable Reyes. Last question. The association of HMOs, how many members are there in your association?
In our association, we have 12 HMOs.
And how many associations of HMOs are there in the Philippines?
There are two, the
AMOPI?
AMOFI and PAMOC.
Okay, so are there HMOs outside of these two associations?
I think so.
Majority are outside or majority are with these two?
Majority outside ba? No, inside. Majority inside within the two organization, but meron pang iba na nasa labas. And one was trying to go with us, nag-enroll sila sa amin.
Okay. Thank you very much.
Mr. Chair.
Yeah. Do you have any? Because I'll be making a motion for the adjournment.
Yes. Okay. A brief manifestation.
Yes, Mr. Chair. Thank you for the recognition and the time. Actually, the Insurance Commission has already provided the framework or the avenue for HMOs to adopt reinsurance in our business. But the interesting thing about HMOs is that we're in between. No, so I think the three things that we have to do to strengthen the industry and to protect consumers, no, and the public, and to complement the universal healthcare law is to ensure this is financial stability and sustainability of HMOs. But unlike pre-needed insurance, our contracts are 1 year. We don't have too much of an exposure. So when you look like college assurance plan where they took, very, very aggressive positions over long periods of time, hindi ho yun masyado mangyayari sa HMO kasi every year. In fact, the HMO is like a gym membership. It's a fixed period. You get access to a network, punta ka, with certain limits. No? But there is also a medical element to it. As Honorable Representative Gomez mentioned earlier, outcomes are also very important. So that's why, as Dr. Leah said, kailangan may medical perspective in regulation. And I think the proper venue to sort this out is really through a technical working group. And I support the thought that it should either be in IC or DOH, but really, having resources from both entities. Because at the end of the day, we need to be able to fund obligations for 1 year. That's the kind of, I think for the industry, that's what we want to build. And that's why we support both. Because we feel that we can be regulated better. If we can be regulated better and we can achieve parity as an industry, then we can assist the government, PhilHealth, in the implementation of the universal healthcare law in a shorter period of time. Thank you, Mr. Chair and honorable members of the committee.
Thank you, Mr. Argos. Yes, Honorable Palma.
Yeah, before I'll make the motion for the adjournment, we will be requesting all the stakeholders who are here to please submit your position paper within 10 days. Kaya? Hindi? Ilan pa? 2 weeks. 2 weeks? Ma'am, kasi please consider us also. We are on the budget season.
Mr. Chair, if I may recommend, we'll submit what we can in 2 weeks, then build
2
up.
weeks?
Yes, because it's a complex issue. I think it'll take some.
Chair, 2 weeks though?
Please do so. 2 weeks in 2 weeks time. Thank
Okay.
you very much.
All the stakeholders that are here, as well as those that already left. So on that note, move for the adjournment, Mr. Chair.
Second, Mr. Chair.
Second, Mr. Chair.
There's a motion to adjourn, duly seconded, hearing no objection. The Committee on Health meeting is now adjourned. Thank you very much, members and our esteemed resource person. Maraming salamat po.